So in this next one I'm going to do a diaphragm and a broad ligament taping, so you can see that you can combine them. When I'm doing it on my own, in my assessment, I will ask them, are they having more groin pain? Is their broad ligament more primary than their breathing? So whichever one is more primary, I would typically do first, but there is no right or wrong answer. So as you can see, we've done the diaphragm, but you can combine this with broad ligaments. I'm going to show a combo so you can see that you can stack these tape jobs depending on your client's needs. So for the broad ligament, you want to do another little anchor piece, because if it's hot and sweaty, hot outside, you definitely don't want the tape to roll on them. So same thing, I'm going to round my corners, and then you want to put this anchor piece as far underneath the belly shelf as you can get without causing it being inappropriate. Right, so again, we're going to put this anchor piece on with no stretch under the belly shelf. And again, you definitely want to pre-measure before you cut, because tape's not cheap. So again, you want to tape up in the angle, again, of around the 10th rib and or like the ASIS. And I always do around 2 pieces. So I'm going to measure the actual measurement first, and then I'm going to cut back either a good quarter, so even about a quarter this way, just so a lot for stretch. Around my corners. You can cut 2 pieces at once if you wish, but sometimes I like to do the first one just in case I've undercut or overcut. So allowing the middle of the piece, so the middle part, you're going to apply, this is too much stretch. I want to do just about like 10% stretch, because when you go to lift the belly, you don't want the tape to roll on you. So I do about like maybe 10 to 15% stretch when I apply this part of the tape. Sometimes I have clients help, because if you drop this piece, it will roll up on you. And you want to pull tension at the same time on both sides. So again, I'm going to go too much. That's lifting her way out of her line of gravity. So I'm going to come back down. And if you cut too long, it's fine. You can just, as long as just don't put in as much stretch. So I'm going to just place that tape down. I'm going to measure the next piece. Same distance. Round your corners. Again, a bit of stretch on this piece so it doesn't roll up on you. And I overlap it at least by half, because you still want the tape sticking on the skin. Can you hold this for me? Thanks. And I like to go almost all the way to pull baby up. If that's too much, then come back down. Rub the tape a little bit to get the heat in the tape.